Hello there, I'm Mabel Zhang, and you're watching the World Healthcare Congress Interview Zone, and I'm very pleased to have with me Megan Zimmerman, who is Executive Consultant and a Chief of Staff at Kaiser. How are you, Megan?
I'm great, thanks.
Great to see you. Now, we're talking a lot about patient engagement here. It seems like patient, that's really the key. What sort of things are you doing at Kaiser to really engage and keep that patient motivated?
You know, Leonard Kish said that patient engagement is the blockbuster drug of the 21st century, and while he said that rather recently, Kaiser has felt that way for a long time, that patient engagement really is the key for health, maintaining health, preventative care. So the things that we're doing to actively engage the patient is emailing, offering online lab visits, online prescriptions, and what you really want is how do you get the patient engaged and sticky and in their own health. Fitbits and pedometers are ways that, you know, right now I'm not thinking about my health care. Right now I'm thinking about this interview, I'm thinking about the conference we're in, but I don't really actively think about my health care. And what we need is for patients to actually think about that all the time and think about their health. And Fitbits are ways to do that, and email is a way to do that and have them thinking about that. So we had 13 million emails last year to our doctors. Yeah.
Amazing. How does that put stress on a system when you're actually getting so much communication from patients?
You know what we do, for a while we've always had team-based groups at Kaiser. We rely a lot on nurses and nurse practitioners, so they're really the front line to the patients. So even in email communications, we have a group of nurses go through those and triage those, so then the doctor gets more of the difficult cases, practicing at the top of their licensure, so that's more enjoyable for them. So the communication is just a way we see as doing business.
You've mentioned that Kaiser received about 13 million emails from patients wanting to know if they should come in for an appointment, you know, take a picture of something they saw on their skin perhaps, and have the doctor evaluate it before actually coming in. Now, may I ask you, do patients like this, or have you had to educate them on the benefits of being more proactive about their health?
You know, it varies. It varies by age and demographic. Our millennials, that's how they want to communicate. They don't even think about another way of communicating with their doctor. They absolutely have that expectation. Some of your other groups, if they're more facile with technology or they already have their smartphones, they're enjoying it. If they don't, they'll call on the phone and talk to their doctor, talk to their nurse practitioner. We've been doing online phone messages with our nurses for years. So our patients are used to this. It's just a slight jump. We're not pushing them to do it. They don't have to. It's just how you can click in, call in, or come in. That's really our motto.
This is your first year at the Congress. Are there things that you are hearing that you believe, oh, we're already doing that at Kaiser? And then on the other hand, have you learned new things?
You know, we talked a little bit yesterday about patient engagement yesterday, and I'm really hearing this from the provider's perspective and from the health plan's perspective and how they see the patients coming in and their concerns about the level of service people are expecting, the level of safety, what about patient health information, how do I cover that, how do I carry that? So I'm really hearing what the concerns are. I think that Kaiser has been a great advisor and can help in those areas and just share what we've done. So we've shared some of our best practices and lessons learned. Also, Intermountain Healthcare has shared their lessons learned. So a lot of wisdom at the conference.
Any surprises?
Surprises? No, I haven't heard any surprises yet. Not that I can think of right offhand.
And what about what you've shared about Kaiser? You guys are experienced in doing a lot of what the sector is now just getting on board with. What have you heard people say about what you're doing at Kaiser?
Well, we always get lots of compliments. I love coming here, and people are great. But you know what I say is we've got capital expenditures, we have to build hospitals, so we have our own unique set of circumstances that are challenges for us. So partnering with industry and hearing what the latest technologies are, and some of these companies, these mobile apps, I think that there's partnerships that can happen along the patient life cycle that we're still open to, and it's still really changing, really dynamic, the marketplace. So we're still open to that partnership and feedback, and we're learning just like everyone else.
Great. Megan Zimmerman, thank you so much.
Thank you so much.
And I'm Mabel Zhang. Thanks for watching.